wow, this is becoming like a huge opportunity for multiple revenue streams in one applicator, one workstation. This is our Lumecca, and this is our 515 cutoff filter. We hit the 515. Why 15? Because she's skin type 1, 2, or a light 3. And so this goes through a water test because like the Dialase 810, 755, 1064, it's water cooled. We can see now the flash lamps turn on and it looks kind of greenish because we're in the green spectrum. We're going to go up to usually 12 to 14 joules per centimeter squared. A pulse duration that's going to be a function of the energy. In short pulse duration, we're going to be 1/3. Let's go up to 15. So we're down at 5 milliseconds now. 5 milliseconds, that's very short pulse duration. And we'll do 1 pulse per second and we hit ready. Every time we do a photofacial, just like hair removal, you protect the eyes of the patient and the treatment technician. And I do a test spot on the table. I want to see erythema and edema. 1, 2, 3. Overlap 20%. Look for little erythema and edema. No blistering, no Nikolsky sign. Wait about 3 to 5 minutes and go ahead and treat at that energy. Overlapping 20% vertically. And if they have a lot of pigment, you might turn around and go pie crust it, but turn it down 3 or 4 joules of energy on your second pass. If they have a spot that you want to treat aggressively, I'll come back. I'll cover up most of my applicator by the tongue depressor, leave just a little bit hanging over the edge and turn up the energy and do a little spot treatment right over the edge of my device by using my tongue depressor to cover up most of that IPL crystal. We want to make sure we treat the nasal alar junction because there's a lot of vessels there. Want to make sure you treat the upper lip, lower lip, and we treat right up to the lower lid lash line, or as close as we can get by pulling the skin down and getting right up close in there, which is why this nice USS Enterprise shaped applicator allows us to get in there. So I'll hand this off to Shelby. You go ahead and treat the right and the left side. A little flash there for you. And let's take a look as we wind up for the smell of lunch. The smell of simple carbohydrates awaits us. Let's split the screen here, Chuck, if you can. And let's take a look at what you should be achieving in often one session. I tell the patient 3 with your IPL. First of all, melanin. In Florida, you got a lot of this going on. Skin types 1, 2, 3, trying to look like a skin type 5 their whole life. What do you get? Dyschromia. And so for someone like this is a workshop patient. I treated the submentum with a quantum, single session Lumecca peak. That is incredible brown clearance. I'll tell her 3 sessions for 50% reduction. I know I'll get 75 to 80, but in one session, skin looks great. This is a workshop patient like you're going to see tomorrow, kind of ruddy, red complected, a little bit of brown. Single session like we're going to do tomorrow. Lumecca, Morpheus, Quantum, toxin filler suspension, all in one session. Skin looks great. Don't forget the hand and the chest. Acres and acres of unattractive skin off the face. This patient comes in like she's only 30 years old. Look at that sun damage. You know, it looks like Tales of the Crypt. You want to bring her back into the land of the living. And this, you got to be careful. You want a pie crust, turn down the energy on the body a bit, single session reduction, but don't leave her tiger striped. Overlap 20%, turn down the energy, pie crust, go 180 degrees on the second pass on the same visit. Because that's what she's going to look like in a week or 2. And she's going to think, oh my God, he burned me. Warn them, they're going to look bad. Then it desquamates and looks good. And here she is when she comes back for a second session, 5 to 6 weeks later. Looks great. Single session Lumecca peak. This is Pico-like or Q-switch-like in its power because of the short pulse duration. Another chest, same kind of outcome. Hemoglobin, this is tougher to get rid of. Most IPLs can't do well on hemoglobin because the pulse duration is a little too long. And if you turn up the energy, you might get a burn. This is very short pulse duration for superficial telangiectasia. A workshop patient, ruddy red complected, like we're going to do tomorrow, single photofacial evening of that red discoloration. Rhinoplasty patient, on the table bundle with an IPL treatment. Go both screens now if you can. PowerPoint, Charles. Thank you, sir. And again, the nose looks okay, but look at the complexion. Single session 515 cutoff filter. God knows why. She pierces her nostril after a nose job. No idea. But her skin looks great. Rosacea, erythema, telangiectasia, single session reduction. This is the one IPL you got to be cautious. You can get purpura. You can get purpura. Patients hate purpura. So be very cautious on really red, ruddy complected patients. Maybe do the 580 followed by the 515. Maybe you offer 4 or 5 sessions, not 3. Don't be aggressive in the first 2 or they're going to get purpura. Hard to cover that up. Male and female patients with red, ruddy skin. If they have dark skin, 4 and 5, I always pre-treat. I pre-treat before we deliver for 6 to 8 weeks with a lightening cream, hydroquinone, kojic acid, ascorbic acid, maybe even retinoic acid. And then I'll do a 580 and then a 515. And I usually do it every 6 to 8 weeks, not every 3 weeks. And I bleach them in between and then fade down the bleaching cream after. So you don't get post-inflammatory hyperpigmentation. Now here's a typical Toronto patient, not Hispanic, but Asian. A lot of dyschromia. Pre-treat for 8 weeks. I use 12% hydroquinone, 6% kojic acid, 5% ascorbic acid, 0.05% retinoic acid every second day for like 6 weeks. Then stop for a week, then do the treatment. After a week after the treatment, get them back on it again for 6 weeks, then do it again. 3 sessions, 8 weeks apart, not 3 weeks apart like skin type 1, 2, 3. And her skin looks great. She's done obviously what we're doing tomorrow, some Morpheus, some toxins, some filler, some suture suspension, but her skin looks awesome because I pre-bleached her, used the 580 cutoff filter, couple sessions of 580. If she looks lighter, maybe a session or 2 of the 515.